FFICM Practice Test 2026 Final Faculty of Intensive Care Medicine SBA OSCE Exam Questions and Prep. Question 1. What is the target mean arterial pressure, MAP, for most patients in septic shock? 50 mmHg, 65 mmHg, 80 mmHg, 100 mmHg. Surviving sepsis guidelines recommend a MAP of 65 mmHg. Question 2. Which sign is a late indicator of tension pneumothorax, tachycardia, hypotension, tracheal deviation, pleuritic chest pain? Tracheal deviation is classic but often a late and rare finding in the ICU. Question 3. The P/F ratio is used to assess blood pressure, renal function, oxygenation/acute respiratory distress syndrome, ARDS, liver failure. PaO2 divided by FiO2, 300 indicates ARDS. Question 4. Which drug is the first-line vasopressor for septic shock? Dopamine, norepinephrine, epinephrine, phenylephrine. Norepinephrine is the gold standard for vasopressor support in sepsis. Question 5. What is the hallmark of neurogenic shock? Tachycardia and hypertension, bradycardia and hypotension, fever and chills, pulmonary edema. Loss of sympathetic tone leads to vasodilation and bradycardia. Question 6. In ARDS, protective lung ventilation involves high tidal volumes, 12 milliliters per kilogram, low tidal volumes, 6 milliliters per kilogram, and plateau pressures 30 cmH2O, high FiO2 at all times, no PEEP. Low tidal volume ventilation reduces ventilator-induced lung injury, VILI. Question 7. Which electrolyte abnormality is most likely to cause a U wave on an ECG? Hyperkalemia, hypokalemia, hypercalcemia, hyponatremia. Hypokalemia is associated with prominent U waves and flattened T waves. Question 8. What is the Cushing's triad associated with increased ICP? Tachycardia, hypotension, bradypnea, bradycardia, hypertension, irregular respirations, fever, rash, neck stiffness, anxiety, sweating, tremor. These are physiological responses to dangerously high intracranial pressure. Question 9. Which mode of ventilation provides a set volume but allows the patient to trigger breaths? CPAP, assist/control, AC, pressure support, PSV, SIMV. AC ensures a minimum rate and volume for every breath. Question 10. What is the primary treatment for hyperkalemia with ECG changes? Insulin/glucose, calcium gluconate, salbutamol, furosemide. Calcium gluconate stabilizes the cardiac membrane, others lower potassium level. Question 11. Base excess provides information about oxygenation, metabolic component of acid-base status, respiratory rate, carbon dioxide levels. Negative B indicates metabolic acidosis. Question 12. What is the most common cause of acute tubular necrosis, ATN, in the ICU? Toxins, hypoperfusion/sepsis, kidney stones, antibiotics. Sepsis-associated hypoperfusion is the leading cause of OSCE in the ICU. Question 13. Which monitor measures the partial pressure of exhaled CO2? Pulse oximeter, capnograph, arterial line, Swan-Ganz. Capnography is essential for verifying ET tube placement and ventilation. Question 14. Propofol infusion syndrome, PRI, is characterized by hyperglycemia and hypertension, metabolic acidosis, rhabdomyolysis, and cardiac failure, skin rash and fever, excessive wakefulness. Pre is a rare but fatal complication of high-dose propofol. Question 15. What is the definitive treatment for cardiac tamponade? Diuretics, vasopressors, pericardiocentesis, chest tube. Removal of fluid from the pericardial sac is required to restore cardiac output. Question 16. The CAM ICU tool is used to assess pain, sedation level, delirium, Glasgow Coma Scale. Confusion assessment method for the ICU is the standard for delirium screening. Question 17. Which scoring system predicts ICU mortality based on physiological variables? GCS, Apache 2, Braden Scale, NYHA class. Acute physiology and chronic health evaluation. Question 18. In the ABCD assessment, B stands for bleeding, breathing, blood pressure, brain. Airway, breathing, circulation, disability. Question 19. What is a common complication of massive blood transfusion? Hypernatremia, hypocalcemia, hypokalemia, metabolic acidosis. Citrate in blood products binds calcium, leading to hypocalcemia. Question 20. Which vasopressor is also naturally produced as antidiuretic hormone? Dobutamine, vasopressin, milrinone, nitroprusside. Vasopressin is exogenous ADH used for refractory shock.